How does baking soda affect joints? How to use baking soda for arthritis and arthrosis. Watch the video till the end to learn how simple baking soda can help treat joint diseases. Joints are the movable connections in the musculoskeletal system that allow us to move, walk, and perform various actions. Each joint is a complex biological mechanism that requires care. Problems occur in joints due to metabolic disorders, inflammation, or injuries. What diseases affect joints? Joint diseases can range from arthritis caused by infections to ankylosis. To understand what might happen in the joints, let's review their structure, which enables movement. Joints are formed by two or more bone surfaces. Between these surfaces is flexible cartilage. Around the joint is a capsule made of ligaments and connective tissues. Inside the joint is a special lubricating fluid. Diseases can affect specific parts of the joint or the entire structure. The most common issues are arthritis, inflammation caused by infections, or autoimmune reactions. Arthritis can occur due to bacteria in the joint or their toxins. Periarthritis, inflammation that affects not only the joint, but also the surrounding tissues, like tendons and muscles. Arthrosis, degenerative changes caused by metabolic disorders, salt deposits, and cartilage thinning. These diseases typically cause pain, limit movement, and deform the joints. In treating these conditions, both medications and traditional remedies, such as baking soda, can be used. How does baking soda work on joints? Baking soda, sodium bicarbonate, is a chemical compound with alkaline properties. It helps neutralize acidity in the body, which can reduce inflammation and inhibit the growth of harmful microorganisms. Here's how baking soda benefits joints. It restores the body's acid-alkaline balance, promoting positive changes. It boosts potassium levels in cells, which is essential for their proper function. It reduces inflammation, neutralizes toxins, and fights bacteria. It increases tissue energy reserves, improving metabolism and speeding up recovery. It reduces swelling by removing excess fluids. It has a pain-relieving effect, improves circulation, and supports lymphatic system function. These properties make baking soda helpful for supporting joint health during illness or after injuries. Traditional healers have long used baking soda for its pain-relieving and anti-swelling effects on joints. Scientific understanding of baking soda's role. Recent studies have highlighted the potential of baking soda in reducing systemic inflammation, a critical factor in managing joint diseases like arthritis and arthrosis. A 2018 study in the Journal of Immunology found that baking soda can trigger an anti-inflammatory response in the body by activating the spleen to produce more anti-inflammatory immune cells, known as macrophages. This activation helps reduce the overall inflammation that leads to joint swelling and pain, providing relief from symptoms associated with arthritis. Moreover, baking soda has been shown to positively impact metabolic processes that are often disrupted in conditions like arthrosis, where joint cartilage degenerates over time. By balancing the body's pH and enhancing cellular function, baking soda can indirectly slow down the degradation of cartilage, improving joint function. Additionally, the use of baking soda for its ability to alleviate symptoms is not limited to just arthritis. Conditions such as gout, which is characterized by the deposition of uric acid crystals in the joints, may also benefit from the alkalizing effect of baking soda. By reducing acidity, it helps prevent the formation of these painful crystals, providing significant relief to patients suffering from gout flares. How to use baking soda for arthritis and arthrosis. Arthritis and arthrosis are among the most common joint diseases, causing discomfort and reducing mobility. To combat these conditions, many treatments are used, including baking soda, both externally and internally. You can make soda baths for the joints or the whole body, rub it into the affected areas, or take it orally. When taking soda internally, start with small amounts, gradually increasing the dosage. On the first day, dissolve 3 grams of baking soda in 150 milliliters of warm water and drink it on an empty stomach. On the second day, take the solution twice. Gradually increase the dose to 15 grams, 1 tablespoon, per intake twice a day for 30 days. After completing the course, many patients report significant pain relief and improved mobility in the joints and spine, reduced swelling and normalized skin temperature around the joints, less redness in affected areas. Additionally, overall health improves, blood pressure normalizes, heart problems subside, digestion improves, and kidney function increases. Compresses. Basic compress. Mix equal parts of sea salt, mustard powder, honey, and baking soda. Apply to the affected area, cover with plastic wrap and a warm cloth, and leave it on overnight for 14 days. Bread and soda compress. Combine equal amounts of sour milk, rye bread, and 10 grams of baking soda. Let the mixture sit for 6 to 8 hours before applying. Leave it on for at least 2 hours. A minimum course is 2 weeks. Soda solution compress. Dissolve 2 tablespoons of baking soda in a glass of water. Soak a cloth in the solution and place it on the joint. Let it dry and repeat 3 times a day for 10 days. Bran and soda compress. Blend bran in a coffee grinder. Then soak 3 tablespoons in 100 milliliter of low-fat yogurt and add a teaspoon of baking soda. Apply under plastic wrap and a warm cloth for 2 to 3 hours. Continue for 21 days. Homemade ointments, Vaseline ointment. Mix 100 grams of pharmacy-grade Vaseline with a small spoonful of baking soda and a large spoonful of thick honey. Rub into the affected joints. Butter ointment. Mix 50 grams of butter with a teaspoon of baking soda and 5 drops of almond oil. Rub into the joints at night. Children's cream. Ointment. Combine 50 grams of regular children's cream with a tablespoon of baking soda. Add a drop of thyme, fir, and peppermint essential oils. Apply 3 times daily. Baths and soaks. For hands and feet. Dissolve 1 tablespoon of sea salt and 1 tablespoon of baking soda in warm water. Massage the joints while soaking for 30 to 40 minutes. Full body bath. Add 200 grams of sea salt and 200 grams of baking soda to hot water. Take the bath before bed 10 to 12 times with a 1-month break between courses, supporting lifestyle changes for joint health. While baking soda offers relief, managing arthritis or arthrosis requires a holistic approach. Combining baking soda treatments with regular low-impact exercises like walking, swimming, and yoga can significantly improve joint flexibility and reduce pain. Exercise improves circulation, which helps deliver nutrients to the joints and reduces stiffness. A balanced diet rich in anti-inflammatory foods, such as leafy greens, berries, and omega-3 fatty acids, can also complement the benefits of baking soda. These foods reduce systemic inflammation, helping to manage the pain and swelling associated with joint diseases. Are there any side effects? Baking soda, especially in high concentrations, can be irritating to the skin. Do not apply if you have open wounds or skin conditions. Avoid ingesting soda if you have gastrointestinal diseases, diabetes, kidney or liver issues, or are pregnant or breastfeeding. Always consult with your doctor before starting any treatment with baking soda. Excessive ingestion of baking soda can lead to adverse effects like electrolyte imbalances, so it's important to use the appropriate dosage. In rare cases, it can lead to metabolic alkalosis, a condition where the body's pH becomes overly alkaline, which can result in muscle twitching, nausea, or irritability. Always monitor your body's reaction and discontinue use if any side effects occur.